Thank you for listening today on Revealing Wholeness, sponsored by Infinity Whole Health. Check out our website at infinityWholeHealth.com, where we are revealing the eternal in each individual, the infinite in the individual. The creativity is made manifest. Limitation is let go. Now, here's your host, Dr. Troy Munson.
Hello and welcome. I'm Dr. Troy. One of the questions that is common for me to get from women is, what should I expect? What's normal? What is optimal? And I want to go through those phases in life of a woman. And by the way, this is not limited to women. Men should understand this about women as well. However, most women have never been told, what does normal or optimal even look like? What does an ideal cycle look like? What does an ideal pregnancy and birth look like? What does ideal menopause look like? So let's explore those things. Not ad nauseum, but let's at least mention some common things that may be problematic. To give an example of morning sickness, we're going to talk about perhaps why that's happening and why it isn't ideal or optimal. So here we go. Let's start with cycling women. Now, one of the fascinating things is moon cycles have forever been synonymous with female cycles because they're 28 days. Now, a new moon is when there is no moon in the sky. That new moon or darkest day of the month, that particular day, is the start of what women would call my cycle. Well, yes, but it's also the start of your entire monthly cycle, all 28 days, not just your period. And so the beginning of that new moon, if things are working well, we now have this period that begins. And it should begin without a lot of fanfare, meaning you don't have cramping, you don't have, anger at everyone and everything, and you're not all of a sudden crying. It doesn't have a lot of emotionality. It simply begins, and it's not particularly heavy. There are no clots. You're not bleeding for 3 days, going through a tampon every hour. It really isn't supposed to be like that. For some of you out there, that might be a shocker. I've had gals come in where they bleed 3 to 3.5 weeks a month, and they have a few days off, and then they're right back at it again. Now, in that particular scenario, that is a fairly toxic individual, meaning your body is not happy with the food you are putting in it. For many women that have very heavy 2-3 days, that also is not normal, or at least not ideal, not optimal, and certainly not seeing clots. This is usually an over-estrogen production as well as an under-progesterone production. So if we look at a woman's cycle through the entire month, the first phase through this new moon phase to full moon is when we have this cleaning of the uterus. Hey, let's get rid of all debris. Now let's rebuild that uterine layer, that lining, because we're expecting to have a pregnancy. And as we're rebuilding that uterine lining, we're upping the estrogen a small amount. Now it is spiking on day 12, 13 with ovulation, and then goes down and begins to settle down for the rest of the month, though there will be a small amount of rise compared to the first 2 weeks in the last 2 weeks of the month. But overall, estrogen stays fairly low. Now, on a blood test, just for some of you out there that may have it sitting in front of you, ever been through that, you say, well, estrogen says it's like 150, and my progesterone says it's like 8 or 12. What do you mean estrogen's less than progesterone? Well, it is quite a bit less, actually, because we have to look at what the values of that 150 are. So they'll be in picograms and nanograms. Nanograms, there are 1,000 picograms in a nanogram. And so estrogen, if it's 150 picograms, progesterone will be somewhere in the neighborhood of 15, 20, 25 nanograms. Quite a bit more than estrogen. So with that understanding, do know that those numbers are actually using different parameters. Now, it would be nice if they just simply use the same measure. Then we would see estrogen at 150, and then we'd see progesterone at literally 35, 4,000, 4,500, something like that, and we would just see it differently. So With that in mind, we definitely want to control the amount of estrogen. Estrogen is not supposed to be high in a woman's body. If it is, you start to gain weight. You start to have PMS because you're dropping off progesterone too quickly. You're not keeping your body regulated, and now there is edginess. There is emotionality. There is crying. There is anger. This is what women would classically call PMS or premenstrual syndrome. Now, the number of days it occurs before your cycle begins, rather your menstrual cycle begins, tells you how bad the problem is. Some women will literally start a week ahead of time. Others, a couple of days. Some go right into their period without any fanfare at all. They have maybe a day of mildly heavy, a couple of tampons, 3 during the day, maybe the next day 1 or 2, and it's a bit heavier. And then the last 3 days are fairly light, tapering off at day 5, and it's done. That would be a normal period. Now, normal ovulation building up at day 13, that's when you're going to find your highest sex drive. So why are there so many children on the planet? For that reason. Your body is literally saying, hey, you've got this one day, this one shot. Don't blow it. And so it raises your desire of sex so that you will get pregnant. Now, that is called the full moon. At the full moon is often times in the past, before electricity, when women would aim for having their wedding, because a conception on a wedding night was considered good luck and a good omen. And so women aimed for having their wedding on that ovulation. Well, it makes some sense, but now all of a sudden, once we have light, it actually messes up our cycles quite a little bit. So you have this moon cycle that would pull the fluid of the ocean around, which is what it does. It also has an effect on the woman's body. So this was just common. So let's say that you're out there and you have a complete wreck of a cycle. Well, wouldn't it be wise to start aiming for those new moon and the full moon of when you're going to start doing certain supplements? Now, I will give you a quick hint and at least something you could do. Let's say that you have a daughter or yourself that's kind of a mess, or maybe you have a spouse, maybe this is a man listening to this, and you do good cod liver oil from new moon to full moon. And then from full moon to new moon, you're doing evening primrose oil, or you're doing black currant seed oil, or you're doing chaste tree, or perhaps all of them. That would be a way to begin to start having your body regulate with the moon cycle, which you may find is quite the blessing, actually. And so then you can see on any calendar when the new moon is and when the full moon is and what you're doing. It just makes a fair amount of sense to have that be the case. So, let's move on. We have kicked that one around, so to speak. Pregnancy to birth. What does it look like? What's normal? What's optimal? Now, I gave a teaser at the beginning of morning sickness. I'm just going to let you know morning sickness is not normal, though it is average. Why? Because morning sickness often will depend on your liver's ability to keep your blood clean. As you start this pregnancy and progesterone stays nice and high because you've got an implanted egg, you have a lot more hormones running around your blood. This means the liver has more debris to detox, and if it's sluggish, those hormones stay high in your blood, and it does not feel good. You feel nauseous. You feel like throwing up, and many women will throw up. And so that is morning sickness. We are going to work on that by doing things like beets and beet greens. We're going to try to help that. Now, let's say that you're pregnant and you're gaining weight, like too much weight. Again, you are likely overeating carbohydrates and you have too much estrogen in your blood. Both of those are growth hormones. Hey, expand, get bigger, they say. So if you want to keep your weight down, you will desire to eat far less carbs when you are pregnant. Now, for the first 5-6 months, that baby is pretty small. You are not eating for 2, by the way. You can eat normal meals and you'll be just fine. So if you find yourself craving foods while you are pregnant, now we're getting into the minutia, which is nutrients that your body is really asking for. So the classic, I can remember this in old movies. She's craving pickles and ice cream. Oh my goodness, she's pregnant. Well, why would she be craving pickles and ice cream? Most women struggle with digestion because their diet isn't that great to begin with. And so they're going to crave pickles for the vinegar to try to add acid to the system and try to help digestion. Why the ice cream? Because the liver needs fats to clean. And so you're going to crave things like heavy cream of ice cream because your liver's telling you it's not very happy. Now, if you've got a diet that you know is not good, you do not feel good, your skin does not look good, you may be a little overweight, and you're thinking about being pregnant, can we just assume that you're probably going to experience morning sickness and cravings and kind of some misery through pregnancy? That will be pretty consistent. So why wouldn't you begin to prep your diet and your body to have a baby? You're getting ready to take 8 pounds out of your body to make a placenta and a baby. If you eat carbs and you are overweight, you will likely have a 9 or 10 or 11 or possibly a 12-pound baby, which means you're going to take even more out of your body. So we want a baby that is not overly big. We want a baby that will be easy to birth and be as little pain for you as possible. These are the ways that we do that. So through month 1, 2, and 3, we're going to watch for things like morning sickness. We're going to do a little extra beets and beet greens in a salad towards the evening. If you need the ice cream, please don't shy away from it, but let's do an organic. Let's do a low sugar. In fact, why don't you make it yourself from raw milk? I know this is asking a lot, but if you've been on my channel a while and you caught this, you're probably already considering, how do I do my diet better? How do I upgrade my lifestyle into a lifestyle that gives me what I want, which is amazing health and good feeling and great sleep and high energy and experiencing life to the full? I would love for that to be your experience. So those first 3 months, we're going to be watching for things like morning sickness, weight gain, cravings. Now, through the second trimester, that's when all of a sudden the placenta now is fully mature. It takes over and produces all of your progesterone for you to maintain that pregnancy. Progestation, progesterone. I am for maintaining this pregnancy. So it takes over. Well, it does need a lot of nutrients. Now, it doesn't need an entire extra meal yet, but there may come a time towards the end where you're eating half a meal more each time. But at that point, your stomach feels so full because that baby's so big in your stomach, it's difficult to digest. So we should be working on digestion even from the get-go. Things like enzymes, things like raw apple cider vinegar if you can tolerate it. Things like, ginger, maybe some enzymes like papaya enzymes. Any of these things would be excellent each meal. And making sure that your meals maybe are a little bit more alive, not so overcooked, not so canned, box processed, fast refined food. That would be awesome. Now, as we begin to gain a normal amount of weight, somewhere around that 15 to 20 pounds, in the third trimester, in month 7, your immune system is now going to turn back on. It has shut itself down, or at least turned that dimmer switch down a little bit, so that it doesn't try to abort the child. Now it's thinking, once we get to the 7th month, we're getting close to getting this baby out of us. We need to clean house of all kinds of things. Bugs, viruses, funguses that should not be there. Many women will actually get a cold in the 7th month as they clean. And ultimately what it really is still a congested liver. And it's not cleaning as fast as the body's immune system turned on and started killing some small colonies of bacteria here, a colony of fungus there, a cleaning house of areas here and there, and all of a sudden overwhelm the liver, and now I feel like I get a cold. Some women get quite drastic colds, or at least cold-like symptoms, because their livers are not performing. What do we do in that scenario? Extra gut support. Raw apple cider vinegar if you can do it. More enzymes if you're okay doing that. If you're not necessarily okay doing either, then you need to give me a call and we need to talk about how do we get some pills down you to help your digestion. If you have a chiropractor, I would definitely be being adjusted at least once a week at this point to try and help keep your body at tip-top shape and make sure your organ systems are working beautifully by having that brain-body connection through chiropractic care. Now, let's talk about birth. What does a normal birth look like? Normal birth looks like somewhere around that 7 to 15 hours. First-time moms will have roughly a 16, 15, somewhere in there, 15 to 17 hour birth time. Chiropractic moms, half that time. So when I say ideal, I'm going to edge toward that 7-hour time frame as the more normal. I have talked about this on other podcasts. My wife in particular, she had a fracture because she was a pretty hardcore athlete when she was young. She has a stable fracture in her low back. And if anybody was going to have a difficult pregnancy, I was thinking it was going to be her. So I would literally check her and adjust her if necessary 2 and 3 times a day towards delivery. And our first child was less than 7 hours, just over 6. The next one, we barely made it to the hospital, just over 2 hours. So even if you've got some issues spinally related in how your brain communicates with the uterus and the ovaries and all those body parts to make sure that they expand and contract in unison and organized so that you can have a child as fast as possible with as little pain as possible, and all those tissues expand and open up so that it's as little pain as possible, you're going to want to make sure that your diet is excellent and that your brain communicates with all those tissues. So therefore, chiropractic can be quite a big boon for those that are going through that birthing process or soon. Now, could we do some things to help the birth process? We can. What would be excellent? Well, calcium is not only a muscle contractile helper, but it's also a tissue relaxer because it's a tissue strengthener. Magnesium is very relaxing to tissues. Good fats like black currant seed oil and evening primrose will help increase the production of oxytocin and relaxin and pitocin, or these like chemicals that are in a woman's body that help them birth. So not a bad idea to get some decent amount of fats towards the end. I'll have some women that will do black currant seed oil when they think they're about to give birth, and they'll do 2 per hour, trying to help produce those hormones and give that nice GLA or gamma-linolenic acid to the body so that it can make those hormones that help that birth process. So some tips for you. Next, last, menopause. What is a normal menopause? What is ideal? What is really normal? Not the chaos that we see out there. Normal menopause is one day you think you're going to have your period and you don't. And you look around and you wonder, why don't I have my period? And you're in your late 40s, early 50s, and it doesn't come. And the next day, it doesn't come. And the next day, it still doesn't come. A month later, it doesn't come, and you never have another period ever again, and you're just fine. That, my friends, my ladies, is a normal menopause. It just simply is done. How do most women feel going through menopause? Kind of like a train wreck. And so as we have these ovaries shutting down and becoming dormant, they don't produce the estrogen and the progesterone like they did. They're done. So guess who has to take over all of that? Your adrenals. What do the adrenals do? Well, they sit on top of the kidneys, and they handle all the stress in your life. And so if you're out there thinking, I'm in my mid-40s and I'm stressed to the hilt, menopause is going to be a bear, I'd have to agree with you, but it doesn't have to be. So as we begin to rebuild your adrenal glands, they need lots of copper and zinc, lots of trace minerals. So we might as well start now. And that means we need to curtail a lot of the sweets and a lot of the carbs. And if you're eating them because you're craving them constantly, then we need to work on your digestive system so you can start processing protein, fats, minerals, vitamins way better. So that when you get to the menopause portion, we don't have as many hot flashes. We aren't wondering why I'm sweating profusely in bed. We're not worried about what's going on around us and hypersensitive and angry all the time or crying the next moment, and your weight is much more manageable. So normal menopause, you can actually get to that. Now, if you've spent your life in a ton of stress and dysregulated, let's say you've been on birth control or some other type of birth control, then we've got some things that we need to clean. Your body needs to clean house of all of these exogenous chemicals that you've put into it that are hormone in nature. And so we need to clean very, very well. And then we need to de-stress. So if you don't already have a spiritual path, you, my friend, my lady, need to get one. So if you have a good support system and you know what you are and who you are, and say no to stress in your life and to those people that are stressful, and you have a blissful existence, then you have a very good chance of going through menopause quite well. Let's say you have a few pesky hot flashes, and sometimes you're a little bit out of your mind, and maybe you've got a little bit of weight gain. Fine, let's continue to do some adrenal support, but let's also work on perhaps some pituitary and some hypothalamus. How would I know if your pituitary is a mess? You probably have shoulder pain, elbow pain, and wrist pain, or at least something like that occasionally. That would be you. And so you've tanked your pituitary and your hypothalamus sitting in your brain trying to regulate your hormones because your adrenals were tanked quite some time ago. So these are some things to fix and consider. Am I happy to help you do that? Of course, that's my job. I love doing it. It is the most rewarding thing to have a woman come in and tell me, my hot flashes are gone. Thank you so much. It is a wonderful thing to have a pregnant mom in and bring her beautiful little child and be able to check this child for any subluxations that us chiropractors call misalignments of the vertebra because they just went through a very stressful process called birth, and effortlessly clear their tiny little nervous system and have them functioning at 100% from day one. And mom being able to nurse correctly, and if she has trouble, being able to help her do that and have her understand of how to do that and have her family grow in health and joy and peace and light. That is an amazing place to be every day. And that's why I love coming to work. It's why I love doing these podcasts. I want to give you a vision of what is ideal, what is optimal. You can actually do that if you want. Now the question is, do you want to? Until next time, I'm Dr. Troy, and remember, there is way more right with you than there is wrong with you.
The information on Dr. Troy Munson's podcast is meant to educate the listener and is not intended to diagnose, treat, cure, or prevent disease.